The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
And welcome to Dr. Tom Roselle Live. We are live in studio on this Easter Sunday. It's beautiful outside. It's nice outside. And there are certain things we're going to talk about that are related to the weather and changes that everyone's dealing with, at least in this area, in the DMV and in Virginia. But I'm assuming that it's also all across the country as well, too. And we're going to be hitting on that lovely topic in just a minute. And probably an extension of what we've been talking about in the last couple of weeks. But I'm Dr. Stephanie Pina, licensed naturopath and acupuncturist. I'm from the Roselle Center for Healing, and I'm obviously filling in for Dr. Roselle. He should be probably in the air coming back right now, so next week he'll be back into the studio. But we're live in here now, and I guess whenever I'm here, I always get guests with me, so it makes it a lot more easier, a lot more fun, and no one better to run questions back and forth with than Dr. Jennifer Sims. Great to have you back.
Thanks for having me back. I didn't know I'd be back so soon.
I didn't either. It works out great.
Works out wonderful.
So I will preference that it's a very good thing that we have Dr. Jen here, because she did just go through some major dental surgery. So we got her ready to come in and talk on the radio, and I said, okay, you can do it. I think you can do it.
Yeah, so if I slur, I apologize. I'm doing the best I can. Thanks for that disclaimer for all you who are listening. I am okay, I promise.
Yeah, we're going to get through this.
We're going to get through
one
it.
Sentence at a time, one word at a time if we have to. So that's the great thing about, Easter Sunday. Everybody's listening intently, I'm sure, and we're going to go through a great topic anyway. Those of you that know Dr. Jen, when she used to be with us at Roselle Center for Healing, definitely has a interest in pediatrics, women medicine, family medicine. And so the topic that we're going to talk about is a slightly different perspective on allergies, molds, all the seasonal goodies that are out there right now that as the sun comes up and we start to get into spring, unfortunately some of this stuff starts to affect us as well too. But are there underlying effects that are going on outside of our runny nose and our stuffy heads and everything that we may or may not be taking medications for? So we're going to dive into that quite a bit. And if you have any questions and you're listening to us, feel free to give us a call, because this is going to be obviously a topic that is going to apply to a lot of different people in a lot of different ways, even though we're going to take a pediatric approach to it today. But I want you to give us a call live here in the studio. The number for WMAL is 888-630-9625. Again, that's 888-630-9625. So allergies, mold, and all of the fun stuff that it brings. So, Dr. Jen, what are you seeing in your practice now that, we're transitioning into a new season? There's the obvious things that come with all the runny nose, the fatigue, and all that stuff. What are you seeing that most people don't think of maybe related to even I would say the topical stuff, the superficial stuff that we think of allergies, that might surprise people that you see quite frequently? And we look at it and go, no, that's an allergy or something else going on, but they're kind of saying, no, I'm going to go back on my allergy medication or get my allergy shot. What do you typically see coming in, especially from the pediatric standpoint?
These kids have the worst burning eyes, really, really uncomfortable, irritable eyes. Obviously, the runny nose and all those type of things that you would normally associate with allergies, but really uncomfortable, unable to focus just because they're so uncomfortable. Now, you and I know it's a gut issue, right? That's what I see when I see kids coming in with allergies. The first thing I think of, okay, well, we got to figure out what's going on with their immune system, their gut. But yeah, that would be the number one thing I'm seeing, just really, really bloodshot, burning, can't go outside for recess kind of situation.
So it's a real catch with them, especially when you bring up recess, because, here we are as adults, and I would love to be able to tell Dr. Roselle, can I go out for recess for a little bit? And you've got recess right after lunch as a child, hopefully. Still, hopefully that hasn't changed. And, now you can't go out there because what's going to happen when you come back in? What's the rest of the day going to be like?
Right. And so that's why the over-the-counter remedies are so appealing, because they symptomatically kind of get you through the day. But unfortunately, we go through that, we take the over-the-counter medications, then we get through the season, and then we kind of forget about it till next year. Whereas we can really start figuring out what the problem is so that hopefully we don't go through it the next year, which would be looking at, how they breaking down their foods, what's going on with their guts, what's going on with their immune system, are they eating well, are they taking, getting the right amount of nutrition, those kind of things. We really should be working on that before allergy season hits.
Right, and I talked about it during the allergy talk, treating ahead of time and not just waiting to that last minute as well too. And even Chinese medicine, one of the first, or I should say the slowest developing organ systems is the digestive tract in kids. So really, when we see them from a acupuncture standpoint, they're coming in, and if you don't go to the digestive tract first,
right,
they're great to respond, but you gotta hit them up where they're probably being ignored the most as well too.
So I always tell people the gut is a tube, right? And it can tell you there's something, it's an open system. So if there's something wrong, you're going to either have it in the presentation of allergies, right? Or you're going to have the presentation of gut stuff like constipation, diarrhea, irritable bowel, bloating, that kind of thing. So when you start to explain to the parents, hey, does your child also have problems with, only liking certain color foods? When you start getting a little bit deeper, they can start to see the connection. Oh, okay. So maybe they don't have stomach aches, but they have this chronic rhinitis or runny eyes or constant having to clear the throat. And then they can start to see, okay, well, I can see how this possibly could be related.
Right. And it's got to be more difficult treating children because sometimes they're not necessarily coming forward and being like, well, I've been suffering for this from years and, this is what's wrong with me. And, it may be something that, especially if it's, and we're going to talk a little bit more about potentially when they're at school and different issues that they may be getting exposed to there, but something that maybe is a little bit better by the time they're getting home. So their parents may not see it, or their parents may be kind of picking up that there's something there, but not really sure what it is. And my pediatrician said that everything is fine and great, and it's just the outside pollens, and we should be fine. Right,
and then they go the traditional scratch testing, allergy testing, all that kind of stuff, which really doesn't help much. It helps. Okay, it's the trees, it's the grass, it's cats, whatever, but it really doesn't help that suffering.
Well, I think one of the good things is, when we look at it from a holistic standpoint too, is we always remove the exposure, right? Mm-hmm. And so that's step one, but unfortunately we can't just not go outside.
No.
We can't just you have an issue with cats and dogs, and so get rid of Fluffy and Fido, and, that's going to create more issues as well too. So how do you eliminate that exposure? So when we do have these outside environmental exposures, and even if we get into chemicals and molds and these other things too that we may or may not even know are available or are seen, what do we do on that inside that's a chronic going thing that shows up this way? So I think that's one of the main things that we have to put our heads together when we have a patient sitting in front of us, and we really have to break down what's really going on with their digestive tract, those mucous membranes that go from the eyes all the way around. So when you typically see someone coming in, especially from a pediatric standpoint, are they coming in being that clear cut, or is there other investigative work that you feel like you have to start to do right from the start if someone's coming in saying, okay, my child has red eyes and, digestive issues and fatigued all the time, it can't concentrate. Where does your mind tend to go from a holistic standpoint that might be a little bit different than conventional?
I think, like you just said, I start to think, okay, well, what is a day for this kid like? Where are they living? What's their environment? Are they in an old home, a new home? If they have some chemical exposures in their home, I'm thinking about, how is this kid eating? Are they getting any sleep? A lot of kids, when you ask them, will tell you they cannot sleep well at night. So we know that means their cortisol levels may be elevated, and that can be causing an issue. I want to know what sports they're in. I want to know everything about them, because it gives me a little bit of a picture of, okay, this may be why he's having, this particular set of symptoms. And then when I am seeing a pediatric patient, I actually go all the way back to pregnancy. I ask the mom everything from, was she on medication? Was it a C-section? Was it a vaginal birth? Were there complications? Try to just get like a timeline of when, has he always had allergies? Is this a new thing? Is there a move? Anyway, I really want to know all about that child so I kind of know where to go. Just like you with being a naturopath and a homeopath. And, it's that same, you got to get the story. You can't just go, okay, well, his eyes are burning and he's really irritable and can you just fix him?
Right.
Well, I need more than that to help you figure out what's going on.
Right. And we've got so many things going on during, say, those 18 plus years. You have so many different transitions, between school transitions, hormonal transitions. I mean, you're seeing the full gamut. So it's not even just, I've been dealing with it for the last 4 or 5 years and everything else. Nothing's changed. How can my stressors be the same? I'm working. But stress in children can be very different. I mean, new environments, new friends. We see more and more activities in sports starting earlier and traumas and stuff that are dealing with that. So how are they kind of functioning through that whole timeline as well, too?
Absolutely.
And especially now, okay, it's spring sports season. Let's get them out there. We got to keep them out there. And so, these superficial allergy types of symptoms, they're going on.
Right.
But now we got to dig a little deeper. What do you feel like there's anything as far as when people are looking from a holistic standpoint that gets in the way? Like, if they're trying to change things with their environment, are there the activities and everything that children are trying to do today, do you feel like that gets in the way of their health and healing?
I think definitely feel kids need to be active, but I do think, especially in this area, maybe not in other parts of the country, but we're overscheduled. These kids are doing a lot. So that can definitely impede healing time. I also think parents are looking for quick fixes. And if you're coming in your office or my office, it ain't going to be a quick fix because we're trying to get to the root cause of the problem. We're not trying to just throw something for symptomatic relief. So I think, sports in the event that they're getting to bed every night too late. They're eating every night out fast food because they don't have enough hours in the day to get their stuff done. Well, then, we need to look at that. Not necessarily sports are bad. I love sports. I think they're great. But what's going on in that kid's life? And that can be a little bit challenging,
And sometimes it's also a big reflection of what's going on with the family life as well, too.
Right.
You're not just healing. It's usually not just their son or daughter that are coming in, too. Their family's part of their healing process.
Right.
It can go either way, right?
Right.
They can be healing them or kind of not so quite healing them. So we have Dr. Jennifer Sims of Blue Sky Health and Wellness in the studio with me, Dr. Stephanie Pina today, filling in for Dr. Roselle. And we're going to be taking questions and going over allergies, pollens, molds, everything that's got the seasonal mix going on. But essentially, what else is that doing to the body? Where else is there inflammation that we need to pay attention to? And essentially, how are we going to start to look at this from a different perspective? You've been listening to us talk about allergies, headaches, everything the last couple of weeks, but let's look at it from a different perspective and also from the perspective of children as well, too. We're going to be back in just a couple of minutes, and you're listening to Dr. Tom Roselle Live here on WMAL. And welcome back to Talking Roselle Live. We are live in studio. I am here with our guest, Dr. Jennifer Sims from Blue Sky Health and Wellness, talking about allergies, molds, everything that's kind of created into the body, into the system, and how is our body reacting ahead of time, and what are these symptoms and stuff that we need to be looking forward to? Is there something that's more underlying that's going on with our stress immune system and how we need to treat it more holistically? We're going to go to the phones. Pete, how can we help you?
Yes, hi. I have a question for you. I bought a pan yesterday, a saute pan, and I haven't used it that pan. I still bring it back depending on what you think of it. It's ceramic non-stick pan, and so I presume it has no Teflon. But it also says it has no whatever these chemicals are, PTFE and PFOA. What is it about those things that make them a no-no?
I think think there's some information that you can find on the different chemicals that are out there, and I think the EPA has got some information on how a lot of those chemicals that are on pans, especially related to Teflon products, get off into the foods and into the water, and can create some issues as well too. And that's why I think you're starting to see, I don't want to say more organic type of pans because that's not the right word, but different types of materials come out that are non-stick as well too. So we might have to use our own natural things to help make pans non-sticky. But I definitely think, and Dr. Jen's going to cue in on this as well too, but I think the ceramic option is probably the best too. The one thing that I always think of when we just purchase something as well, is just like with clothing stuff too. Remember that they're usually going to have something on there, to kind of preserve it to make sure that it's okay in the store. So I would always wash everything before you use it, especially where you just bought it yesterday. So it seems to me like the ceramic version may be a little bit better of a version. It always seems interesting when they find a new chemical. It's not until a little bit later that we find out if it's actually doing anything harmful for us. So it seems like that might be the best option. So the good thing is where you're looking into other options that are non-Teflon. I think that's a good thing. Dr. Jen, is there anything you want to add?
I think with the PFOAs, they're concerned about a lot of things here. Cancer, specifically kidney, testicular cancer, thyroid issues, liver damage. So like Stephanie said, as these things stay on the market longer, they realize the side effects and they go, oops, maybe we shouldn't be using them. So I think since we don't have a ton of options, ceramic is good and glass is always good, provided it's a good quality glass that doesn't, break when you put it in the stove.
Cast iron.
Excuse me?
What about cast iron?
Okay, with cast iron, I will say it does have benefits, but I will also say that I have had patients who use cast iron a lot, and it does put iron in your bloodstream. Iron can be toxic at high levels. Men typically don't menstruate, right?
Mm-hmm.
So
as far as we know.
As far as we know. That could change. No. So if there's too much iron in your bloodstream, it's very hard to get rid of. So I think it's great, but not used for everything. In fact, I've seen some patients' iron levels through the roof because of using only cast iron cookware. So in moderation, and maybe if you know that your iron levels are to begin with, because it can potentially not be the best choice.
Yeah, I think that's an excellent answer. So it's a great question, especially leading into what we're talking about today, because we have to think about everything that the environment has to expose to us, which environmental medicine is very tricky because one alternative can lead to another issue as well, too. So thank you for calling in, Pete. And so we're going to go back to the topic on hand of allergies and mold. And so we see an interesting trend, and you can definitely speak for this in the pediatric community, of we get exposed to the world, we're born, and sometimes first things that sometimes parents come in for might be some kind of skin rash. Maybe not diaper rash, but some kind of skin rash that looks very interesting, especially with new parents going, I don't know what this is. And then all of a sudden, later on, that starts to develop into the earache. And are they in swim class? And we're looking for all these different things. And then all of a sudden, there's asthma issues and stuff. They're all related, correct?
Absolutely. And we all know that they are pretty much the immune system telling us there's something not going well. There's some kind of immunological reaction happening. And babies especially don't detoxify as well as big people do, right? So their skin is going to be a manifestation of the inside coming out. Those ear infections are often due to food insensitivities, dairy consumption. It could be swim lessons. There's multiple things. And then as things get left untreated or improperly treated only through medications, then we start seeing the asthmatic kid. I have babies coming in that are being tented with nebulizer type of treatments. And parents do need to know that steroids will affect how children grow. I have a lot of kids right now that I see that are considered failure to thrive because of long-term steroid use, So.
And we see what I think is always interesting too. We see this with more and more PPRIs and GERD in children too. So where's their digestive tract starting? When we come back in just a little bit, we're going to keep this going, allergies and molds with Dr. Jennifer Sins. And we're going to start to go into the mold part because there's some interesting information that we need to dive a little bit deeper to see maybe our chronic allergy symptoms are related to things that we don't see or that lurk behind moldy doors and moldy windows. We'll be back in just a couple minutes.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And welcome back to Tom Roselle Live. This is Dr. Stephanie Pina filling in for Dr. Tom Roselle, and I am in studio live today with Dr. Jennifer Sims from Blue Sky Health and Wellness, who's got some great information, and we're going to even tell you how she's going to give you more information towards the end of the show, so make sure you're listening all the way through on this Easter Sunday. We're talking about, obviously, the allergy issues that are going on right now. What's beyond the symptoms of the runny nose and the headaches and the pressures and the fatigue and stuff? Why do we get these on a seasonal base, and what's really underlying, and what could else be going on too? As I led into it, or I led out of, I guess, at the end of the last segment, we're talking a little bit about the unknown factor that might be in the walls and the basements and every other place. Sometimes we can smell it, sometimes we can see it, but this sometimes doesn't need necessarily to be water damage in there, but molds themselves, how is that affecting us? And we see quite a few people coming in, and there's some distinct characteristics that we see with particularly with patients who have mold issues. But Dr. Jen, why don't you go ahead and start telling us about some of that, and then why is mold becoming more of the issue, probably even more so than allergies? Because once those allergy seasons kind of ends, there's still some of this lingering stuff going on, and we don't have necessarily means to get rid of molds if we don't see it.
This is a whole topic in and of itself, right? So what we're finding is that mold is really, really poisonous. It's toxic. It's something that we cannot ignore, especially with the data coming out. If water sits more than 48 hours, I don't care where it is, there's mold growing. So if you think about that in relationship to a leak in your home, a leak in the roof, a flood in the basement that was never properly taken care of, there is mold present. And just because you may not necessarily be in the room with it and you don't smell it, it doesn't mean that it's not there. And from a pediatric perspective, we are seeing kids that are being misdiagnosed with asthma, and they don't have asthma. They actually have mold toxicity, but it presents like asthma. It looks like asthma. Kids who wheeze must have asthma, right? That's how we think. And the reality is, a lot of times it's not that, and giving a child steroids to treat asthma when it's not actually diagnostically asthma will actually make the mold worse in that child. And the symptoms are, there's 37 symptoms of mold toxicity, and they range from things that are benign, from like a runny nose to clearing of the throat, to muscle twitches, inability to sleep, chronic fatigue, depression, visual disturbances like eye changes, things that can mimic fibromyalgia, chronic fatigue. And in fact, it's not any of those things, right? So then you find yourself chasing that rabbit hole. Well, I have this symptom, or my kid has this symptom, so we're going to go to this doctor and this doctor and this doctor. But nobody really sitting down and looking at, oh my gosh, this could be something, it could be one thing, right? And so I really think it's important to start asking the question, hey, have you had a leak in your house? Or in your, whatever, you know what I'm saying. We need to ask those questions.
Again, going back to what's their story, right?
Exactly.
Really looking at health and healthcare from a different perspective and on a unique individual perspective, instead of saying you should have these symptoms that everyone else has, and so the treatment should be the same as everyone else. Because we can even look at this from a genetic perspective, which I know you've been seeing more and more research on. Mm-hmm. But some of those symptoms and part of a child's story is schooling. Where are they all day long? Now they're outside as well too. And I know growing up when I went to the barn, you knew the molds were coming out because you could see it growing in the barn, but you didn't think anything of it. You just kept going. And, we had hay around and everything. Not everybody is going to be out there, but a lot of the times the things that we're involved in all the time, it's just could possibly one exposure after the other.
Mm-hmm. So schools are a big thing for me right now. It is appalling how much mold is in our schools. And our kids, we send them there all day. The schools, a lot of them are old. My older excuse me, I can't talk today with all this dental work.
It's that mold. No.
It's all the metal in my mouth right now. My older son is in a school where they're completely renovating it. You can smell it. You can smell the mold. You can see the mold. Kids, even schools that are not being renovated, schools are probably one of the most toxic places because of high mold counts. And schools are aware of this. Please know that. And they usually just send janitors in with Clorox or a vacuum and very superficial cleaning. And it's something that I think that if more parents were educated about the toxic effects, how it's affecting themselves, how it's affecting the teachers, and in those kids, that there can be a really good uprising and getting these schools cleaned up and remediated properly, not just covering, surface kind of stuff. And like I said, I think this is actually an epidemic. It's a problem. I don't think there's enough doctors who know about it. I certainly don't think there's enough education around it. And I'm hoping that that changes.
Well, and we also see this from the adult perspective as well, too, because some of those same buildings that were schools now may have been, especially in this area, government buildings that were built a while ago. We're seeing some remediation going on in those buildings as well, too. We've got some patients who have come in who have been like, we're going to put you on leave for about 2 weeks and then come back, and they notice everything was done, which that new flooring now brings in its other environmental issues as well, too. But we're seeing that exposure, too, so they could be getting it home. It could be a lot of different places. And even at home, we have to think of more than just the leaks in the attic and the basement, but where's water also coming in? Where's the outside getting in as well, too? So a lot of different things to think about, even just before we look at anything as far as any testing or anything like that. What's the environment that we're in, and is that hurting us to begin with? I mean, toxic building syndrome was something that came up like 70s or 80s, and we were starting to put green plants to get more air in there and stuff. But at the same time, too, I'm going, what else is going on in there? And we had patients that would come in and complain about this and say, I don't feel well in my work environment. But they really weren't getting listened to. So the same thing can probably happen, but a child is not thinking of that in their school environment. They might be kind of complaining about that focus, that lack of concentration, the digestive issues, and diagnosed as something completely different.
Yeah, and right now there's a lot of teachers that are noticing, hey, on break I feel fine, or on vacation I feel fine. When I go back into that classroom, I don't feel well. And there's so much education, like I said, that needs to be spoken about around this. And not all of us genetically can get rid of mold easily once we leave the environment. There's some of us that literally our immune system holds on to it, very analogous to Lyme. There's some people that can easily filter out Lyme, and there's other people who are horrifically ill from Lyme. It's the same model. And if we don't get, we don't get a handle on this, it's going to get worse. And if we don't, start doing the proper testing, asking for the proper testing, even with mold kits, understanding the right kit to buy, we're not going to know. And, we see so many people, kids too, but adults in your practice on so many meds. And it's like they're chasing the heart issue, the stomach issue, the vision. Everything is...
It's all separate.
It's all, but it's not.
Okay.
And that's my point. And I think with kids, because they don't have the insight to give us exactly what's wrong, but they do know something's wrong.
Right.
And when you ask them questions, as long as they can speak, right? They're not babies. They can give you some answers, but you have to know the right questions to ask. Especially in the classroom. Is it, are they only misbehaving or not feeling well in this setting? And then to speak to the outside, mold is high out here. Aspergillus is really high in Northern Virginia. It's a mold. So if they're already being exposed to mold at home in school and then they're going outside, they can't get away from it. Your body starts reacting. And so it's really complex.
So when we look at that, if we think there's exposure there, whether it's a child or an adult, what do we know that's starting to happen? We see these symptoms. They may be familiar with it. They may have, like I said, gone to a bunch of doctors. Everybody looks at things on a separate level and says, okay, this is what we think is the treatment. But what are we really seeing as far as the way that the immune system's breaking it down? You mentioned genetics can be a factor, and how we're kind of trying to essentially detox and process this stuff because we're getting bombarded with it all the time. We won't even discuss the fact that, you know, the adrenal system's seeing that as a chronic stressor all the time because we always talk about the adrenal system here. But what are we seeing that we can start to do to help improve the immune system and really the first steps that we start to see when we treat somebody?
I think once you get the proper diagnosis, treatment can really be quick. Symptomatically, you start to feel improvement. We can get rid of that chronic rhinitis and throat issue. You know, a lot of people, it affects their vision. We can start seeing changes in the vision for the positive. So it's really first knowing, is this actually the underlying problem in your kid? And then once getting the blood work, and we do nasal swabs, and there's specific things that we do, then it's not that hard to actually start getting improvement. However, you have to leave the environment. So we cannot, just like anything else, you can't do all this work and change the internal environment, but then be back in that external environment that's toxic. That's why I think it's a bigger issue. And if we can get parents educated to push the, the school systems to clean up the areas, then we can win, right? But if we're doing all this and we're still having to go right back to that school, that home, that place of work with what you're talking about, you're just never going to get the healing that you need. And unfortunately, these are really hard conversations to have, to say, hey, you know what, your job is literally making you sick.
Right. Yeah, whether you're the employee coming in or the student saying, hey, what's going on with this, or you're that building owner as well too. There's a lot of different ways to kind of look at this and kind of say, okay, when do I have to put the money in for remediation? When do I get tested? What do I do about this if we find it?
Right.
A couple weeks ago, I think I mentioned on the allergy one that thanks to actually a contact that Dr. Jen had, that she has in her resources, was able to have her home looked at. And not only find a lot of mold in the places where she was sleeping, which if there's going to be any place to keep less toxic, it's the bedroom where you're trying to rest and recuperate and revitalize. But then she was also picking up on EMF waves. And so she came in.
That's a whole nother topic.
That's a whole nother topic. We're not getting into that. But she was coming in and they were saying, does anyone ever sleep on your floor, like in this particular room? And it was right over where their servers were. And, it sounds weird that someone would do that, but what if you have a guest over? What's their exposure and stuff too? What if you have someone who is sensitive and they're coming to your house and they now leave and they have an issue, or you're sleeping in a hotel room while you're traveling? Those are tough things because you may not go back to that hotel room again, but you may have gotten that exposure. So there are a lot of things that we need to do to investigate what are these ongoing symptoms, but then what can we do ahead of time, or if we're getting caught into this kind of chronic symptomology over and over again, whether it's allergy, molds, or whether it's home or across the country.
Right.
You're listening to Dr. Tom Roselle Live, and this is Dr. Jennifer Sims. We're talking about allergies and molds from a different perspective, not just about your runny nose and your itchy eyes, but what's internally going on to help break down these symptoms, and is there other things going on? And one of the great things is that when we talk about continuing education and really getting this information out to people is really trying to get them to bring in their issues as well too. So feel free to give us a call here. The number is 888-630-9625. Again, that number is 888-630-9625, and we'll try to answer them before the end of the show. Everyone always calls in at the end, so it's really, really great because you're going, which one can we get? But we've answered some questions off the air as well too. And then if you always want to listen to the other shows that either I've done or Dr. Jen or Dr. Roselle, you can go to the YouTube channels and listen to Dr. Tom Roselle Live, the YouTube station, and then you can put in whatever you want. I'm sure this topic has been discussed before, but probably not from this perspective. We've been talking about allergies in the last couple of weeks as it's gotten worse, but definitely not from this perspective. Dr. Jen, on the other hand, is also going to be putting in an in-house lecture coming up, and we're going to give you all the information you need during the last break on how you can get a hold of her to go over this as well too. But when we're talking about mold itself, it doesn't necessarily be the stuff that we see, the dark, black, creepy stuff.
No. In fact, interesting, when you do have a remediator come out, they actually look for different molds than I'm recommending as well. So the education around this is huge. You have to be checked for the right kind of molds that actually hurt human beings. I mean, we all know black mold is bad, but there's other ones too. No, you do not have to visibly see fur on your walls to have mold. So that's the thing. Like I said, it can be hiding behind walls. It can be, in the bathrooms. I mean, think about how many bathrooms, it's just moisture upon moisture. A fan that's not being properly, or it doesn't work. How many bathrooms have you been in? There's no fan, and you're taking showers. And so it's not like you're walking in and there's this infestation of black mold. It's subtle. I've seen it in carpets. I've seen it in windowsills. I've seen it in windows that are leaking. Maybe you're in an old home. Maybe you just purchased a home. You don't think about stuff like that. But those symptoms will start to creep up in those really what seem to be benign places.
We're going to be back in just a couple minutes, continuing to talk about allergies, molds, and the effects that it may be having on you. And we're going to give you the information about Dr. Jen's incoming in-house lecture that she's going to be having with her contact information as well. And we'll be hitting the phones as well. So stay tuned with us, and we'll be back in just a moment.
105.9 FM and AM 630 WMAL.
And welcome back to Dr. Tom Roselle Live. We are live in studio taking your questions and talking about allergies, molds, and what it might be doing to the body outside of just the typical runny nose and fatigue and stuff that we get with seasonal allergies or short-term exposure. But how is the body dealing with this? When do we have to look a little deeper? I'm live in studio with Dr. Jennifer Sims from Blue Sky Health and Wellness, and she's going to be having an in-house lecture called Can Mold Be Making Me Sick? Perfect. This is a great lead-in, I think, because I think if we haven't started to get people's minds thinking about this, this certainly is going to do it, so they'll even have their questions ready to go for you. And that's going to be at her office on it's Tuesday, May the 28th, which is the Tuesday right after Memorial Day. And the best way to get a hold of her, if you want to register for that, is going to be to give their office a call, which is 703-975-9144. Again, that's 703-975-9144. And then you can also email her directly right off of her website, which is blueskyhealthandwellness.com. So that's all written out. So again, that's blueskyhealthandwellness.com. And there's a click on to contact her, and that's going to be the best way to get a hold of her if you're interested in this lecture, but also if you have any questions about this show as well, too. So, Dr. Jen, real briefly, the key topics that you're going to be talking about?
The key topics really, because, my passion is little people, is really figuring out how we can get our kids healthy, figuring out how to get parents to start asking the right questions for their kids, knowing how to test for mold. And also, if anybody's listening out there that can get me connected into a school system that can also help me go teach these educators what we need to do and that this is a problem. But what we're going to be talking about mold, testing, how to get rid of it, all that kind of stuff. But with me, it's always a kid spin on that.
Exactly. We're going to go to the phones real quick. Paul from Alexandria, how can we help you? And thank you for calling in at the end of the show.
Good afternoon. Can you hear me okay?
You can.
Good afternoon, Drs. Stephanie and Jen. I wish you all a happy holiday time, whatever your preference is in celebrating. Thank you for taking my call.
No problem.
I just wanted to give a little anecdotal testimony, if it's all right, regarding my allergy symptoms, which were more of what you were discussing, the nasal, the throat, the eyes itching, the coughing, the sneezing type of thing, and especially during springtime and fall. I noticed once I eliminated gluten from my diet, and for the most part, wheat, barley, rye, and oats, it was unbelievable. The allergy symptoms were greatly reduced, if not eliminated totally. And another thing, I sing in a bluegrass gospel group, a little amateur thing, but I noticed shortness of breath. But I noticed something when I took more omega-3s. I use flax oil capsules, about maybe 7 grams a day, and it was that was definitely eliminated all my shortness of breath. And I was just curious if you can comment on that or discuss that a little bit.
Oh, absolutely. And I think that's a perfect lead into how do we support the system, especially the digestive tract, even though we're thinking these as respiratory issues, whether it's the breathing or the runny nose and stuff as well, too. Dr. Jen, did you want to play on anything else?
I mean, taking gluten out is a fantastic thing. It's highly inflammatory. It's full of chemicals. I mean, I'm sure you guys have spoken about this multiple times on the program. And to speak to EPA and DHA and omegas, I could do an infomercial on omegas, on how they help reduce inflammation, repair the lining in the gut, help with the blood cells. So I think it's absolutely fantastic that you can call the radio program and give a testimonial on the power of just diet.
Yeah.
You're not telling us, oh, I took a bunch of medications. You're saying, I made a couple simple changes, and I can sing better, and I feel better, and that's fantastic.
And I think, so thank you, Paul, for calling. That was a great call for us at the end of the show. And what I think is really funny about that, too, and what's great is sometimes it's not about the symptom relief. It's about the functionality of what we want to do, so where that can help him sing, whether it's an amateur group or a professional group or no matter what we want to do. I mean, those little things that we can tweak can be the right thing when we know, okay, let's decrease inflammation. Let's work on getting out some of these factors so the gut can heal. Let's work on sleep as well as too. So we look at all these little factors and they don't seem like much. Some of this seems like very basic information, but at the right dosing, with the right person, with the right monitoring, that functionality really starts to get better and better. I want to thank everybody for calling in and listening to the radio show. Dr. Roselle should be back next week, and you're listening to Dr. Tom Roselle Live. Have a great weekend.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.